Welcome, everybody, to the Mansfield Buzz. Hey, welcome everybody to the Mansfield Buzz. Just point out really quickly that we are located here, youtube.com at Mansfield TX Buzz. Come join us if you haven't subscribed. Go subscribe, hit the little notification bell. So anytime we're on live every Thursday at 2 p.m., you'll be notified to join us on the next stream. You got Hurdy Burke, a host, Jordan, who host, and you've got Crystal Schuder from Schuder Insurance, who we're going to talk to here in a few minutes. But before we do that, Jordan, want to hear something cool?
Yes, please tell me.
All right. So, we've been doing this since March, and every week we try to give our fans and people that are watch an update. We launched the channel back in March. We've done very little marketing. We let the people come on, share their links, and build the traffic. Cool thing is, we're now up to 56 subscribers. I hope to be at 100 by the end of the next 2 months. 2.8 thousand people viewed our channel in the last 28 days. We're over 6,000 views total since March, and we're averaging about 45 watch time hours a month.
Wow.
So we're excited. Hey, and if you want to be a guest on our show, it's real simple. You can find us anywhere on Facebook. You can type in my name, Hurdy Burke or Jordan. You can email us messages and say, hey, I really want to be on your show, and we really want you to be on our show. But really, guess what? We are booked now, Jordan, through October 13th. So we are now booking into the last 3 weeks of October, going to November and December. So, all right. So today,
and if you want to be on the podcast around Q3, I mean, that is a sweet spot, especially if you're in retail.
Yep. And I know Crystal Schuder link a little bit out there. So if you happen to be a friend and you're listening in, you can comment on the stream. I can even share that comment and let her comment on that comment, if that makes any sense. Okay. So today we're going to talk something that I'm involved in, and we're going to talk about Medicare and health insurance. And Crystal's going to be sharing us a lot of things that are happening this year, some big updates. And Jordan takes away, how do I say this, Jordan? I'm a little bit rock and roll and you're a little bit laid back. Is that how we kind of introduce ourselves on the Buzz, right? So
yeah, we should just go for good cop, bad cop, That's sort of
right.
But
before you get to the questions, let me, Crystal, tell us a little bit, just fill us in a little bit about yourself and where you're kind of from. I think you can, just give us an overview.
My name's Crystal Schuder, and I am the agency owner for Schuder Insurance Agency here in Fort Worth, Texas. And I have been married to my husband for 29 years. We have 4 children, still 2 children at home. So, and my oldest daughter, Harley, she works with me in Medicare. And so we are and then we also have Carolina, who works with us as well. So we're a 3-woman agency, all women, and we'll take care of all your needs that you have. So anyways, but yeah, so that's it. Just a Fort Worth girl, been here forever.
Hey, loving it. Watch it grow like a weed, right? And but you're in a good place and a good time. So Jordan, this first question is going to have a big answer. I'm telling you right now.
Yes, yeah. Start with the questions, and this is great because Hurdy, you are very knowledgeable about this, and I am not. However, I think a lot of particularly.
Are you saying I'm old? Are you just insinuating that I'm an old guy now, or what?
You're knowledgeable. You're full of wisdom.
I'm messing with you. Come on.
Wisdom comes with age, right? So
that's right. That's a good answer. Yes. Yeah.
But particularly people in my generation, I'm a millennial, and or moms and dads, like all our parents are starting to start walking into this program. So I think this is going to be really helpful to just get a little bit of an overview. And I love that we have knowledgeable people on the subject and like completely like neophytes, because we'll be able to just give a little bit more background, because I will definitely ask a few questions when you go through. It's like, I have no idea what you mean. And actually, this is one of those, right?
Right.
What is the Inflation Reduction Act? That sounds super technical. It sounds important, but I have no idea what that is.
Yeah. Okay. That is something new that is starting January 1 of 2025. So the Biden administration passed this act a couple of years ago, and it's taken some time. You know, it takes time for everything to kind of get into place. But this is going to affect your prescription drugs. So starting January 1 of 2025, a lot of people, and Herdy probably knows about this as well, but right now it's for you and your carrier. Once y'all get to a that you pay $5,300 for this year, then you go into what it's called the donut hole, and you have to pay 25% of whatever that amount is for that prescription drug until you reach $8,000. So the max out of pocket right now is $8,000 for your drug plan, for your drugs. And then you go to catastrophic, where you don't have to pay as much anymore. And most people don't even get in the donut hole unless they have tier 3, 4, or 5 drug plans, which are the higher drug plans. And the good news is, come January, the most out of pocket is $2,000. So they're going to go from $8,000 down to $2,000, which is really beneficial for all the beneficiaries that are on Medicare. They will, though, have a $595 deductible that they are going to have to meet. So they meet this $595 deductible plus the $2,000. With that $2,000, the pharmacies, and I don't have all the information how all this is going to happen. It's supposed to come out in the next a couple months. But the pharmacist, your pharmacist, is going to be able to put you on the down payment, like a payment plan, where you can pay this $2,000 out throughout the year. Because sometimes someone's drugs might cost $1,000. So in January, after Christmas and all that, if you have $1,000 prescription drug in January, that's going to hurt a lot of people on fixed incomes, because they're all on Social Security, right? Mm-hmm. So that's why they came up with this down payment. So we will know more, and I can talk more about everything when it comes out, but also all the carriers' information for their prescription drug plans and all that will be available October 1st. So I can talk all to people about that then.
Okay.
Yeah, and let me jump in here on that, because being in that program, I understand tier 1, tier 2, tier 3. Yes. And, you know, when Jordan, just to kind of fill you in a little bit, when somebody gets into the Medicare program and they have to sign up for a prescription program, either through an Advantage plan or through a separate provider. Right. And you have to keep that intact to keep everything intact, if you want to know the truth. But the deal is that tier 1 drugs are a certain amount of money, tier 2s are a certain amount of money, tier 3s are certain. And some of these people right now that are really sick or have on certain diseases are paying way over what the cost of the drugs are per year that they'll supply, and they have to come up with money outside of that. And so a lot of people may not know that it gets pretty expensive even for people that are on Medicare if they hit a certain level of payment. Did I word that right? And we don't know what those costs are yet, because they don't ever publish those, do they, Crystal, till right at the last minute, sometimes.
Right,
after they've released it.
Exactly. So. Yes, they do. But it's just it's going to be a lot for all beneficiaries are going to have to check into this to make sure, because it's going to affect you, because it affects your prescription drugs. And, but that's why you work with an agent too. So
yeah, and we'll talk about that at the end, because
later on. For sure.
Because it's complicated. It's not, but it is. Okay. Once you see how the picture lines up together, it's fairly simple, but not on the front end. There's a lot of stuff you have to do.
Exactly. Yeah.
That's why you hire her.
Educate.
in going in, and bringing out the unknowns. For example, like I don't know what the tiers are. So you mentioned tier 1, tier 2, 3, and 4. Like, what are I understand is different medication pricing, right?
Right. It's a formulary of the prescription drugs. So whatever that is they do tier 1, tier 2. Those are normally, you don't have to really pay anything, but I think next year you're going to have to. It might be like $10, $15. I don't know yet, but they are going to have to pay probably something for a tier 1, tier 2 drug. And then 3, 4s, and 5. 5s normally are cancer drugs. For the most part, there's some others maybe for other big sicknesses that there are, but so that's how it goes. I don't make those rules for the drugs. This is all government. This is all your government.
Yeah.
Is that the breakdown based on how much they cost, or is it based on the illness?
It's based on what's in that drug. So whatever, they have to put in the drug, it's based on that. And also pharmaceutical companies. So, yeah.
Yeah. So you learn really quickly how this is all controlled, and you're kind of at the mercy of what they decide to do.
Exactly.
So I am on one tier 1. I'm not going to say it's no big deal, but that tier 1's free to me. But depending on what prescription plan you choose, it could be money out of your pocket on the front end, or it could be more money out of your pocket. And next year, I get the feeling that you're going to see charges tier 1, tier 2, tier 3, period. So, it doesn't matter. I'm good.
Exactly. Yes.
But also real quickly, so that has to do with the Inflation Reduction Act, right? That's strictly for the prescriptions across the board, period, right? No other programs in that. Okay.
Right. Yeah.
All right, Jordan. Yeah. We're not done talking yet, but
we had more, buddy. I'm glad I know now what Inflation Reduction Act is. I thought it was some kind of weight loss, like.
You thought it was building roads, right?
You can decrease the inflation around my midsection. Where do I sign up?
I know.
There goes the show. No. Save that for the shorts.
Exactly.
I will. Okay.
So then another one too, and now that you're talking about like the tiers and all these medications, and I mean just medicine overall is complicated. So what does Medicare cover?
Okay, when you go on Medicare, it covers Part A, which is your hospitalization, hospice, stuff like that you're admitted to hospitals, okay? And your Part B is your doctors or labs or MRIs, CT scans, stuff like that, is Part B. And your Part B also has a premium that you have to pay every month, and every year it goes up or down. So right now it's $174.10 for this year. And I'm not going to know what it's going to be for 2025 until around November, and sometime in November. And so that's your Part B. And then you have Part D, which is your prescription drugs. So that is your drug plan. And also, if you do not sign up for a Medicare at the time you're supposed to sign up, you can be penalized. And that penalty will follow you the rest of your life.
Yeah.
So, So just, make sure you talk to someone and all that. Like I talked to someone a couple weeks ago. He's still working, and he signed up for Part A and B because he just did it. And he's and I was like, well, you don't really have to get on Part B yet because you're still working. And as long as you're still working, you won't get penalized. So he's like, yeah, okay, well, I'm going to work another year and then I'm calling you. And his wife's like, he should have called you before he did all this, but he didn't. So I'm like, well, that's okay. It's fixable. It's fixable. No problem. So anyway, so that is what Medicare covers. And you also can get on Medicare, well, that's our next question. I'll save that.
Well, and let me fill in a little bit just from experience on that, right? So the $174.50 automatically, if unless you're on an Advantage plan, comes straight out of your Social Security check.
Even
So
on your
whatever,
Advantage plan.
right?
Because that's
Yeah,
part B. So yeah, even
right.
on that.
Comes right out of your so when you retire and you start getting Social Security, you're going to see that taken right out of your check. So you're pretty much guaranteed to keep that plan.
Exactly.
But
Exactly. Yeah.
but it fluctuates. So we don't, and Crystal's right, we don't know next year if it's going to go down because of inflation or if it goes back up. It could maybe go to 180. But the bottom line is, I even think our deductible. Well, it depends on who you choose for your supplemental, right? Which we're gonna talk about, right? Hopefully a little bit. That Jordan, just so you know, Plan A and B are great, but you need to have a supplemental to fill in for those costs out of the Plan B that aren't covered, right? And so you'll have to have a premium for that.
Mm-hmm.
And a premium for your prescription. But if you
Yeah.
don't get any of them, you're in trouble. And what is it? Is it still, Crystal, is it still 3 months for age 65? You need to qualify? You have 3 months before,
You
3
have
months
7
after,
months.
right? Yeah, you have
you
7 months,
that
right.
you can do that. Yeah, 3 months before, the month of, and 3 months after. So yeah.
Yeah.
And I actually misspoke. It's 164.10 this year. 160.
Yeah, because I think they
My
dropped it. They dropped it down finally
Yeah,
for
so
1 year.
I don't know if it's going to go up or if it's going to go down.
It'll go up.
Probably. Last year it was.
It'll go up.
Yeah.
Yeah.
Predictions
I'm pretty darn sure. So
Yeah.
It's also a benefit, before we talk about who qualifies for Medicare, right? That even last year I was on a different Plan D. And then I discovered by going and shopping Plan D that I could find this company that was just trying to break into the market, was offering a extremely, what? That's for real? I think I even asked somebody that, is that for real? And so I was able to switch plans and actually not have any medication costs. So it pays to at least look at your D, right?
Yeah, it does.
And decide, and Crystal can help you decide on what the qualifications are next. So hope I'm not going down the road. I'm just bringing my experience into this. I went
through. Good. And that's good that you have that experience. So see, you can help people as well.
Well, no, I sent them to you.
Now, I do notice that for the people that know their ABCs, we conveniently skipped C. We went
yes. Well, part C that some people talk about, that is actually Advantage plan because it covers everything. So it has A, B, D in it, all in one, that you're not paying a premium for, all, everything. Then you they consider an Advantage plan Part C. So and I need to go back on Part A. You have to work 40 quarters, which is 10 years. And then that part A you don't pay for.
Right. Yeah. You're qualified. That's important because a lot of people think they're going to get it just because they're done working. And I will tell you that if you do decide to take Social Security a little bit early, I didn't. I'm 70, so I'm good. There are some criteria of what you can and can't make to not be penalized on your Social Security. Okay, so that's another conversation. All right.
Yeah, I don't know that.
I know. Yeah.
Your financial planner has that.
Right. But I'm just saying, she may get that question, right? And that's where she turns them over to a CPA to make sure they're in line. So
exactly. Yeah.
All right. So Jordan.
Yeah, I think this is really leading us to the next question.
Yeah, who qualifies for Medicare? Okay. Several ways it's a couple ways actually. Turning 65, then you if you're not working, you have to go on to it. So say that you're not, people retire at 62, and so when they turn 65, they have to go on it. If you're still working, then you don't have to go on it. So that is the one. You have to be a resident of the United States for 5 years, consecutive years, and or if you are disabled. And if you're disabled, you have to be disabled for 2 years. And then after that 2 years with no interruption, so 24 months consecutively, then you can get on Medicare at that. After that 24 months, you can get on Medicare as well. So there you go.
So I'm not going to get into the politics of this, but
and I don't make any of these rules, so please don't get
no,
mad.
but I'm saying you can. My point is you can understand the pressure the system's on because 10,000 baby boomers are retiring every day, and so this is becoming the big part of the government expense back to folks, right? So that's all I wanted to say was, that baby boomers are retiring left and right now. So yeah.
So we'll see how long it lasts.
Yeah, exactly.
So like I say, I hope it lasts as long as, for me, but of course, Jordan, for you too. I think you're younger than I am, but
yeah, he's only 21.
Oh yeah.
So
not even.
So by the way, you do get thick books from the government. They do send you your Medicare book, and or you can get it online. It's very detailed about what it doesn't cover and cover. So you're pretty well, if you like to read, you can figure out exactly what's covered, not covered, and before you even go to a doctor, right? So there you go.
Yes, exactly. They're going to send you in September. So everyone that's on Medicare gets a book. And that book has what is covered this year, what's going to be covered next year. So you can compare them. And that's normally right before AEP, which starts October 15th through December 7th. And that's when you can change whatever plan you want. Anytime you can change during that time. Right. And it will start January 1 of the following year. So,
pretty cool.
Yeah. So,
is there any way to get that in a PDF format instead of an actual book?
I don't know. I don't think so.
That is something I totally give to ChatGPT, and she'd be like, "All right, could you break this down for me? Like I'm 5."
When you go sign up,
but also though, Jordan, a lot of this is not against Herdy now. A lot of beneficiaries, they want it mailed. They don't want it emailed to them. I think the more years that go, then yes, they will be able to do that. But right now, they don't do that. So
and you go sign up for Medicare.gov and get all your information.
Yeah, that is true.
If you choose to, right?
Yeah, if you choose to. Yeah. So.
All right. Exhaustive.
So going back to, and that was medications are C, right?
D.
No, D.
D for drug. D for drug.
There it goes. So then this part is tricky, right? Like from my perspective, I thought Medicare just covered everything. I thought like after you made it past 65, like you're good. Like you don't have to pay for anything.
And that's not
the case at all.
Yeah. I mean, don't get me wrong. Medicare is really, I think it's really good for the beneficiaries. I think they do really well with them, and it depends whether you want a supplement plan with your Part D plan or you want an Advantage plan. And I just educate the people and then let them make their decision whether they want to, which way they want to go. But your Part D medications, some are covered and some are not. So I'm working with someone that is turning 65 in the next month or so, and I am going through all their drugs, and they're on like 10 drugs. Well, all the drugs, so 9 of them are covered and 1 of them is not. And this one that's not covered, it is actually the generic of it. So if I put in, and I have to kind of figure out, okay, is this generic or is this the actual drug? The actual drug is covered. So then I have to go back to the people and say, okay, you're taking the generic. Can you take the regular drug? Because it's covered where your generic is not. And that generic drug is going to cost them $100 a month. So you just kind of have to, and then I also have some clients that they have a lot of drugs as well. And probably 4 of her drugs were not covered. And so, and I don't know how to do this, but she's like, that's okay. I will go to the Canadian pharmacy, because there's a Canadian pharmacy in Florida, and people will go there and get their drugs. So for cheaper. So I was like, okay, that's fine, but yeah, there are some that are not, and if they're not, then they have to go back to their doctor and say, okay, this drug's not covered. What other formulary can I put in this? And so it's just when you're working with someone, especially when you're coming on to Medicare, you really need to tell the person you're working with, the doctors, all the doctors that you see, and all your drugs. So then that way you can make sure that you're going to get covered. Because if you get put on something and you don't do that with the person that you're working with, when you go to get this prescription in January or November, whenever you get signed up and that prescription is not covered, then they're going to come back to you and say, hey, Crystal, we went through, why didn't you tell me that my drug wasn't covered? Well, I didn't ask for your drug. So it's just covering yourself to make sure that everything that they are covered like they need to be. Because, you're not taking a drug unless it's a sickness that you're trying to keep under control too.
So from my experience on the site, the really cool thing that Crystal now has the same ability to look up on your behalf, right? If you use her as an agent, but you can also, when you go to sign up for that prescription drug plan on D, you can in fact see what tier it is and see what the drug cost is going to be. So you know exactly. So you can type in literally all your medications and say, okay, it's going to be this. And that's what makes you look around for the different plans, because it can be a different price depending on the company.
Exactly. You're right.
A tier 1 is a tier 1, but it could be a tier 2. I mean, it just could be more money with somebody else.
Exactly.
It just depends. So
and also with the medications, the drug plans, there's so many different plans out there by all the different carriers that you might pay $4 or $5 for one plan, while some other people are having to pay over $100 for the drug plan. So there, and so it could start for $1 and go all the way up to, I've seen drug plans for $150 a month. So, but it depends on what drugs they're on. Because like what Herdy said, that yes, they will cover, the more you're going to pay for your drug plan, they're going to cover more of your prescription drugs.
Mm-hmm.
So.
Yeah, it pays, Jordan, just to kind of fill you in, it pays to shop it, because I will tell you something. When I first started on my plan D, I was with SilverScript, and SilverScript was basically cheap. It was like $10 a month with no deductible. It's now over $48 a year, not including the drug cost. So by switching, I saved myself a ton of money. I did,
Yeah.
So
I would like to point out to the audience that Herdy reads like the Google's press releases and understands the things that are coming out on the applications and integrations. And Herdy's like technical understanding is, I would call it above normal.
Yeah.
So don't feel like you need to go online and figure all this out yourself. He can.
Oh, no, definitely not.
He's Herdy.
With someone.
If any of this seems overwhelming, which I know to a lot of people will, there's, give you a call. Right?
Exactly. Yeah.
Yeah. So that's probably a good point, because I do over research things, but on the other hand, I also know that if somebody starts on this program, I'm sending them straight to Crystal, right? Yeah. Because I know that they'll take care of it. I'm just trying to fill in the gaps of what you have the ability to look at too. You're not dead in the water as a consumer. You can ask I had to ask my agent, is this for real? When I was looking it up, I made him research it and come back and say, yeah, you need to be on that. So that's why you have the agent.
Exactly. Yes, for sure. So, yeah.
Yeah, and I love how you point that out, because I know, for like, my mom is on Medicare, and I know this has happened for a few prescriptions she takes, that she didn't used to pay anything, and suddenly she had to pay like $80 for it. It's like, why am I paying for this now?
Yeah.
And I mean, I don't know. She doesn't know either. But to be
Yeah.
completely honest, like I didn't even know, like I don't even know she knows who her agent is, or she can even like contact somebody to talk about this, let alone shop a plan.
And a lot of people don't even know their agent. So because people get calls constantly, which I can help people. Just a side note to get on the 1-800 do not call list so you won't get those phone calls anymore. But you really need to know who you're working with, because like there's changes every single year. And if you're working with someone, then you can. And also, I'll put out there, I don't get paid by the beneficiaries. So I get paid by the actual carriers that people sign up for. So I don't really care who you sign up for, because I have lots of carriers. So but I want you to be comfortable with who you're going to sign up for, and that you're happy with the plan that you're signing up for.
Right.
And I'm not going to persuade you one way or the other. If you want a supplement plan where you pay your supplement, your Part B and your Part D, then that's fine. You can do that. Or if you want to be over here in Part C, Jordan, which is the advantage plan, then you can do that too. So I give you the information, and then you make the decision on what you wanted, what you choose to do. So, and I'm here to answer any questions that you may have. So, but I'm not going to tell you, hey, you need to get on this plan, or you need to do this. I'm not going to tell you that. So, and if people are doing that, you don't need to work with those kind of people.
There you go. Agreed. 100% agreed.
Yeah.
So to take a little bit of a detour here, these are two that I get confused. I almost said the wrong thing just last question. Are Medicare and Medicaid the same?
No, they are not. They're different. They are both government services, but Medicare is it's federal, and it's 65 or older, or if you're disabled. Medicaid is federal and it's state. So, and that is for people that have limited income and or resources. So for Texas, okay, if you need to get on Medicaid, you can, there's a website, and I can tell people what the website is. I cannot sign you up for that. You have to do that all on your own, and do all that. So a lot of people, lower income people, they're familiar with Medicaid, and they can get on that and all that kind of stuff. So, and if you are on Medicaid as an adult, they don't have dental. So, so if you're on Medicaid as an adult, you need to get a different dental plan so you have dental coverage, because if not, you're going to pay out of pocket for that. So,
know all about that.
Yeah. So, yeah, but they're both, you should know about both of them, and which one is going to help you and which one isn't going to help you. So, anyway.
Yeah. And you may have to jump through hoops on Medicaid. They're going to make you apply. They might deny it a couple times before you get it. I went through that. A family member, so I get it. Yeah.
Yeah. When people come to us and talk about Medicaid and like they can't afford this and they can't afford that, then we'll say, okay, what is your income? And if their income is below a certain amount that we know that they can get Medicaid, then we'll say, okay, you can go to texasresourcebenefits.com, which is how you sign up for Medicaid, and apply there. And if you can get it, then there's other services and resources that we can help you with once you get on it. So, but yeah, so
there you go.
Okay, so then that is different from the Affordable Care Act, right?
Yeah, Affordable Care Act is for people under 65. So, and this is actually, it's really Obamacare. So remember when Obama passed this law for the health coverage for everybody and all that? Well, this is what Affordable Care Act is. It's ACA. We call it ACA. And most people qualify, and it is income related. You can also get on ACA if you make over the an amount too. What happens is when you are applying for ACA, then you have to put in what you made on your taxes. So on your W-2, they put that on there, and they have to match. And if they don't match, then you could get penalized at the end of the year when you go do your taxes the following year. So, so like someone that is working and they decide to retire, but their wife is not 65 yet, then sometimes their wife will get on an ACA plan for the next year or two. If they're not, even if they are sick, they can get on it because you can have, there's no limitation. So they can't cut anyone on this plan. So.
But their deductible will probably be pretty high as usual and keeps going up.
It could be.
It could be. Depends on the plan.
Yeah, because the less money and you have to make a certain amount of money. So if you don't make any money, then they're going to tell you need to go apply for Medicaid. And if you make, I think it's 25,000, I think, or 20,000, then if you make that, then they're going to give you where they're going to give you some money to put towards your ACA plan. So some people might not pay anything for their plan, but they're going to have a $1,000 deductible or $1,000 out of pocket per year or whatever. So, and we can, and Carolina, who works in my office, she is she's the person for this. She knows all about it. She's been working with this for probably 6-7 years now.
Yeah.
So she's really good at this and helping with people on that.
Super.
Yeah. So anyways, but yeah.
Good.
With this Affordable Care Act, one thing that came in mind is, because of, the economic situations currently, there's a lot of people getting laid off. And one of the probably more stressful sides of things is whenever you get laid off, well, you typically have your insurance through your employer.
Correct.
So whenever that, not only does your income go away, but you also now lost your insurance coverage.
Right.
Is this something for them to turn around and look at?
Yes, it most definitely is. The open enrollment for ACA is November 1st through December 15th, but then they'll normally extend it from until January the 15th. So you can change anytime during this time as well. But if you're working and you get laid off or you get fired, then you can get that because they consider it a special enrollment period. We call it a SEP. So they can do that. So if you lose your job, you get married, you move out of a certain area, a certain county, you can change as well on that. So have a baby, if you have a baby, there's lots of different little things. So we can help you if you have any questions on that. So
yeah, because Crystal can go in, Jordan, and there's probably a bunch of different levels of plans you can pick as an individual or family, and so they can step you through that to see what your actual premium's going to be.
Right, exactly.
But it's going to be a lot less than paying the COBRA or whatever after you're let go if you pick up their insurance. So
the COBRA one,
it's worth a look through. It's worth a look through.
It is worth.
That's for sure.
It is. And sometimes ACA. You have to pick your PCP, and ACA is all HMO. There is no PPO plans. Okay, so you have to have an HMO doctor, and we have to kind of figure out what doctor that's going to be. So it takes a little time, but it's okay. That's what we're here for. We're here to help you and do what's best for you on that. So
Crystal, what's an HMO doctor? What's an HMO? What does that mean?
Oh, and that's the group of plans that they have to be in network.
Right. They can't be. Yeah, they can't go to anything out there. They got to be in network with a specific doctor in that network.
PPO and HMO.
Right.
A PPO, you can. Most PPOs, you can go anywhere you want to go with that. It's a plan that doctor. But on a PPO plan, that doctor may accept. They will accept you, but you're going to pay more out of pocket because they're not in network. And with an HMO plan, you have to be in network and go to have referrals, all that kind of stuff. You got
just fine. It's a good
Yeah.
way to go.
Yeah, which is really on the Medicare side. It's not bad because most people love their PCPs, their physician that they go to, and if they're going to get a referral, they're going to listen to them. So a lot of the Medicare plans are HMOs, but they're really good plans, guys. So
Yeah, they are.
But, yeah. Anyway, so yeah.
So then so looking into the Affordable Care Act, there's also a network for children.
Exactly. So when you're applying for ACA, a lot of people they call us, and most people want to be in the Cooks network. Cooks Children's here in Fort Worth area or Tarrant County. They want to be in that network. Well, unfortunately, Cooks doesn't accept ACA plans. So you cannot go to any Cooks. So it's been a little difficult for us trying to help people with that. But also when you're applying, it may kick you out and your child will get approved for CHIPS, which is a government form, or Medicaid, and they can go to whatever doctors they have for that. But on ACA, we just kind of want to let people know, hey, sometimes if you want Cooks, then if they're affiliated with the Cooks Children's, then you can't go to them on ACA. And that's what a lot of people want. So we kind of, have to work with people to say, okay, we can't go to that, but maybe if you want to go here, so we kind of work with people because we know when kids are little, you want them to go to the best place. And actually here in Tarrant County, Cooks is it. So for children, so you want that. And so we kind of help navigate that part of it as well. So we just wanted people to be aware. So that's all.
Okay, that is super helpful.
You're welcome.
And then earlier on, we teased about ancillary products.
Yes. So, okay, these are extra benefits. And these are like stroke, heart attack, cancer, long-term, short-term, dental, vision, hearing, and hospitalizations, where you can get hospitalization. And then also we have 2 that we work with for that are medical. And actually I am on one of these because when you are a small business owner, it's very expensive to have health insurance. So about 9 years ago, people came, and really since our whole marriage, because we always owned, we've always had independent insurance. So we go with a company called Philadelphia American, and that company, and we also work with Manhattan Life. So both of these companies are medical insurance, and we can go to any doctor that we want to, and it's considered a PPO plan, and they're going to pay so much out of pocket. So if we go to the doctor, they're going to pay $150. If our doctor is $200 to go to, then we have to pay a $50. We got to pay $50. So on these plans, and it's like that with everything. So if you go to the doctor, if you go to a specialist, one of my daughters broke her arm, and I didn't want to go to Cook's emergency because I didn't want to pay $1,500 out of pocket, because these only pay $300 to go to the emergency room, which is not going to get you anywhere. So we went to urgent care. She got her hand x-rayed, and they were like, it's broken. I'm sorry, you got to go to Cook's. So I was like, oh, because it was like at the growth plate. So we went to Cook's, had to get all that done. And at the time, I don't have to pay anything out of pocket. Well, on our plan, we have an accident plan, and also an accident plan as part of one of this as well. We had that, and we ended up going to the hospital, getting all this work done, everything, and she had to go back and forth to get more x-rays and everything. And I, because I had my accident plan, I paid nothing out of pocket, and we got $1,200 back to put in our pockets.
Wow.
So with these plans, so you kind of, I do tell people about them, and they work great for us, and we're healthy. I mean, yes, I like have a thyroid issue. My husband, he's got high blood pressure. He's got like sleep apnea stuff. He's got some issues as well, but this plan works for us, and it works great. I mean, so don't be scared or shied away on these products, because I've been on this plan. Really, we've been on these kind of plans forever, but on the Philadelphia American, we've been on since 2015, and we've been very pleased and happy. And we pay $600 a month for all our stuff, guys.
Yeah, that's awesome.
And if we didn't, then we would pay probably $2,500, $2,000. Who knows what our bill would be?
Yeah,
So
be huge. And
anyway, so maybe you just pay a short amount, and then if you want, you can put extra money in savings in case something bad does come up. You'll have it. So
okay, so Herdy's getting ready to tell you something.
Okay.
7 years old. What does Herdy have? So let's get Jordan really confused here, okay?
Okay.
So he's been talking. What is D? What is C? Well, Crystal, what is G?
Oh, plan G.
I have G.
You have G?
I have Aetna G as my
yeah.
supplemental, but I'm not finished. Hold on.
Oh, okay.
I have an accidental. I have an accidental policy.
Nice.
For a reason, because I get paid back when I go to the doctor. I get reimbursed for blood work or whatever. Plus, if something happens, it's got a good coverage to it. It's Manhattan, just so you know.
Good. I got it.
I'm on a cancer and a heart policy that fills in the gaps for those. So for the major things, if something major were to happen to me, I'm pretty much got the gaps filled enough where I'm okay. All right.
Yes.
So there's some things I may have to whittle out from a cost standpoint, but they're not as expensive as people think. They should ask about them, because I can just tell you up front, the heart one and the cancer combined is around $62, and my accidentals around $25. So you know what? It's worth it on top of my G and my A and B. So and my D, Jordan. So there you go. So A, B, C, D, E.
F. Yeah. The alphabet is the supplement plan. So
it's exactly
right. Great plan, because he and also if you a supplement plan is pay as you know, and an advantage plan is pay as you go. So you only pay if you go. And most of those don't have a premium. So you're just paying your Part B. And then if you go to the doctor, whatever, actually it's specialists. So because your PCP is $0. But as your specialist could run $15, $20, $30. It just depends on the plan. Yeah. But so that's really good. And one of the cancer plans I have is phenomenal. So normally, if you get cancer, they're only going to test it with like 4,000 people to see what is a good treatment for you. And one of the cancer plans I have, they send it to Arizona, and they test it against 19,000 people.
Yeah. So wow, that's cool.
Because you're greater, they can find, say, oh, okay, this plan might work for you. You're testing it against, almost 4 times as many people. So they can come up with a better plan. And the hospitalization is really good for people that are on an advantage plan, because they're going to have to pay if they're in the hospital, stays 1 through 5 or 1 through 6. If they're on regular Medicare, they're going to have to pay days 1 through 60. And that's like $1,600 if you're on original Medicare. But if you're on an advantage plan, it just kind of depends. But normally it runs anywhere from $1,200 to $1,500, and you can get a hospitalization plan to cover that for like $40 or $50 a month. And I would rather pay $400 a year than to come up with the $1,600 or whatever if you have to do that. So that helps people as well. Just for it's just an extra benefit cushion for them, that they don't have to come up with all that money at once, because they're all on Social Security, and that's a lot of money to come up with if something you got. And that you can go to the hospital and they'll do that deductible 5 times, guys, 5 times a year.
Right.
So Yeah.
So I don't really count the money it's taken on my Social Security, the 164, because it's
Yeah.
out and you don't see it.
Yeah.
So technically, just to fill Jordan in, I pay 148 a month now, a month now for my Aetna G.
Hmm.
Okay, it's not a lot, good coverage,
Right.
along with my accidental around 15, and then my heart and stroke around 62. So I'm less than a little over almost $300 just for those great things, and that will save me a ton of income if something catastrophic were to happen.
Yeah. Exactly.
So,
Exactly.
so it's worth it.
Yeah.
Do
And
your research.
yeah. Definitely phone call to me.
Call Crystal, because I'm telling you, I've been in. She's a client. I don't mind saying this up front. I've been in their office. I've met her daughter Harley, and they know their stuff. And the fact is, they can make this easy for you. You can just go in and say, "I'm getting ready to start this," and they'll take it from all the way from square one to the end. So all you have to do is just know, peace of mind, it's done.
Right.
And that's the beauty of it.
Right.
If you're now, if you're like Jordan says I am, and that is Mr. Research Guy, because he can't help it, then I like to learn about stuff. So I like to investigate stuff. But I didn't question my insurance agent at all. Matter of fact, I let him just take me through it, and I said, this is what we need to do, and he said, Turdy, this is what you need to do.
Exactly.
The
Yeah.
insurance agent's going to be pretty upfront with you and say, this is what you need to be thinking about doing. So
Yeah. For
yeah.
sure.
Mhm.
For sure. So yeah.
And
Wow.
there's obviously, I feel like I always bring up strategy in every podcast, but there is a strategy to this, right? So you want to get with a professional that can guide you in that strategy, because as you mentioned it, you could be paying a lot of money for generic medicine that if you just switch to the brand name, which is very counterintuitive,
Right.
you could just not be paying for that. And I can see so many people that are stuck in that boat because they don't know how to navigate this specialized space, especially when you first get into the program, is very new and different.
Exactly.
So I can see a lot of people in that boat. So let me ask you this: for people watching that have had a little bit of a aha moment, and it could be somebody that's currently Medicare, or it could be somebody who's like somebody like me, that I can think of my mom and I'm just like, I got to take her to talk to you, because we obviously don't know what's going on. And there's, there's money left on the table, and we're definitely putting and spending some of the money that we probably should not. So how do we go about that? Especially if, we probably have another agent who we don't know who it is.
Right. Then, well, like I said, coming up is annual enrollment period where you can change, but you should have a review of your benefits every year with someone.
Absolutely.
So, even not if you don't want to wait till the end of the year, do it in the middle of the year. That's fine. And like I said, it costs you nothing to talk to an agent. It costs you nothing to talk to them. So, you just need to have a review every single year of your prescriptions and all that, especially, like I said, coming up this year, there's so much happening. So you really, really need to talk to people, talk to an agent.
Be really interesting to see what things or what numbers come out this year for stuff. We all wait anxiously to see what's been decided, right? So
Exactly. I'll have to come on in January, February to
yeah,
tell you.
I'm already thinking, since we're talking about this year, it probably wouldn't hurt to have an update next year about this time and say, here's what's going to go on in 2026,
exactly.
because this is kind of time stamped for this year. But that's the way it is. Everything's time
Exactly.
stamped in the medical field. So
Yeah.
insurance. So
a weather forecast for this year's insurance game.
Well, it's complicated, folks, and that's why I just tell everybody, go see Crystal, right? Go to Schuder Insurance. It's got a great website, by the way. Their website's laid out really cool. Go visit it. It's got shows all their staff, shows all the things they do.
Yeah.
They got a cool office. You're located in Fort Worth, right there in the medical kind of district, right? Rosedale and 35, right?
We are. We're right at Rosedale and Main Street. So we, we're right across the street from the Tarrant County Health Department. So if you know where that's at, We're right there. We're in a white L-shaped building, and it says Schuder Insurance.
That's your building too, right? That's
Yeah, it is.
I mean,
It's actually,
y'all built that together, so
it's
yeah.
actually my husband's. It's been in his family since early 80s, 90s. But we did a fantastic remodel a couple of years
ago. It looks great. I've been there. I love it.
Come and see us. Come and see us.
Yeah, great way. And I will be there shortly because we have to talk about some other things, but that's really good. So thank you.
Thank you.
Great information. Thanks for filling us in. And you guys go check out Schuder Insurance. And Jordan's going to probably start some music here in a minute because I can't get to it. We like to go out with some music or something.
No, that's fine. Yeah. Come see me.
All right, guys. Hang with us for a minute, okay? Crystal, we'll see you guys next week. We're on every Thursday at 2 o'clock. And I will tell you right now, Jordan, surprise, Minuteman and Dave from Benjamin Franklin Plumbing are coming back on again next week because they're in such demand. They got new questions and people want them to come back. So they're back next week.
Nice.
Wow. So thank you, everybody, for listening to Mansfield Buzz. See you next week, Thursday at 2 p.m. live on YouTube. Y'all have a good day.
Bye. Thank you.
Hey, y'all.